Hi everyone. What started in Wuhan, China in December 2019 and later reported to the World Health Organization and then pronounced as a global pandemic has now spread across 185 countries of the world. And in fact, almost 3 million people are now infected globally. And it is thought that over 200,000 people are now dead. In this video, we will be taking a closer look at COVID-19, how countries respond globally. In this episode, we will be looking at different continents and we will be looking at the top heated countries in those continents in an alphabetical order. To start with, we will be looking at Africa. As at today, according to Johns Hopkins University and the BBC as well as the World Health Organization report, Africa currently have confirmed cases of 30,306. The number of deaths in Africa has increased to 1,375 people, and the recoveries is thought to be around 9,087. And the infected countries in Africa are 52 countries. And we understand that there are 2 countries that are free from this virus in Africa, Lesotho and Comoros. So our first country to look at in Africa is South Africa. South Africa currently have the highest number of confirmed cases. It's thought to be around 4,220. And we have 79 deaths, and about 1,473 people are now recovered. As we all know, South Africa has a history of HIV and tuberculosis, and in fact, at some point, the World Health Organization reported that globally, 1 in 5 people aged 15 to 49 in South Africa are likely to be HIV positive, and in every 3 hours, we have 1 or 2 or 3 people dead from tuberculosis. South Africa seems to have acted fast, more efficiently and more ruthlessly to combat this coronavirus pandemic. And the country has been in lockdown. It has the highest number of cases in Africa, and it has enforced lockdown up to humiliating its citizens, beating up, even shooting civilians on the street of the commercial capital in Johannesburg.
Lockdown's a lockdown, eh? Don't just go and check out this side.
I'm not sure if this is the right way to deal with this global pandemic. Other part of the world, we have such lockdown being in place, and especially here in the United Kingdom, I'm not sure if we currently have this kind of enforcement in place. Police beating civilians or people on the street. No, we don't do that here. But I think the communication maybe could be a lot better. Gavin Churchyard, director of the Aurum Institute, a Johannesburg-based research and healthcare non-profit organization, has said that there has been a lot of infrastructure in place in South Africa, and these infrastructures were previously put in place as a result of the high level of infection around HIV and tuberculosis. And these infrastructures, these facilities are now channeled towards dealing with COVID-19. Hopefully, with the robust infrastructure in place in South Africa, they will be able to curtail this global pandemic. Moving on to our next country. The next country that is mostly heated in Africa is Egypt. Egypt currently have about 4,092 cases, and they currently have 294 deaths, and we have the total recovery of 1,075. As at 21st of March, the Egyptian authority has been dealing with isolated cases, and prayers has been suspended in mosque. By 2nd of April, the response to COVID-19 was delayed. There was no social distancing in place. Al-Azayed, health minister of Egypt, went to China to show solidarity. And by the time this health minister returned to Egypt, there were 12 confirmed cases of COVID-19 on a Nile cruise ship, which sailed from Asan to Luxor. The prisons were overcrowded. The right group has called on the government to free prisoners. 27 hospitals have now been designated to quarantine patients. In March, tourists complained that only the Asian tourists are tested in Egypt. And as at this time, there is curfew in place in Egypt. And there is so many allegations that the government of Egypt has covered up a number of COVID-19 cases of related death and not disclosed this to the public. Hopefully, the Egyptian authority will see the importance of this global lockdown and they will put in place a robust infrastructure to combat the global pandemic. Moving on, our third heated country in Africa is Morocco. Morocco, they currently have 3,758 cases. The death rate has been around 158 and we have 486 recovered cases. In Morocco, COVID-19 has increased the public trust in the government, but people still doubt the effectiveness of healthcare system, according to the Moroccan Institute of Policy Analysis. There has been swift measures put in place by the government. On the 17th March, King Mohammed VI met with top government officials, and by the 20th of March, state of emergency was declared in Morocco, closing the airports, schools, mosques, cafes, and shops, and preventing large gatherings. By 2nd April, 5,000 people were arrested for violating the state of emergency that was put in place by the Moroccan authority. In fact, $3.2 billion of emergency funds has now been raised to tackle this pandemic in Morocco. The Moroccan health minister has also been given daily briefing as well to update the citizens on the progress on COVID-19. Hopefully, Moroccan government will be able to put in place a robust infrastructure in terms of good hospital and other facilities to deal with the global pandemic and reduce its spread across the country. Number 4 on our list of top heated country in Africa today is Algeria. Algeria currently have confirmed cases of 3,127. Death toll has increased to 415 and there has been recovered cases of 1,408. There has been COVID-19 reported cases across 17 of 48 provinces in Algeria. The borders have been closed. Flight and ferries has been banned. In fact, public transport between cities has been suspended. The good thing about Algerian government is they have been able to support the 50% of the workforce by paying them for being at home for 2 weeks. In terms of the lockdown, this has been ended in the northern Builder province where the COVID-19 started due to Ramadan. This has now been replaced by curfew. According to the Prime Minister of Algeria, Abdelaziz Gerard, the curfew is now replaced and is due to be starting now from 2 p.m. to 7 a.m. 9 other provinces, including Algiers, has also seen reduction in the lockdown and replaced with curfew. Also, the Algerian government has been able to free 5,000 prisoners with less than 18 months jail sentence to serve. The health ministry has at some point approved chloroquine to treat COVID-19 patients. However, World Health Organization has said that they will not approve chloroquine to treat COVID-19. Hopefully, the Algerian government will see a way to ensure that even with the Ramadan, the lockdown is not lifted to ensure that this global pandemic is not spread across the country. Next on our list of the top heated country in Africa is Cameroon. Cameroon has recorded 1,430 cases and 43 deaths and recovered 668 people. Cameroon is the most impacted country across Central Africa. Cameroon, like most of other African countries, has closed its borders but has not imposed a lockdown or curfew. Coordination of COVID-19 effort has largely rested on the Prime Minister, Dion Gote. In early April, a month after the first case of COVID-19 was recorded, Cameroonians mounted a social media campaign demanding that 87-year-old Paul Biya addresses the nation like most of his peers across the continent were doing. The minister, Manaudo Malachi, in outlining government strategy to deal with the pandemic, said 6 main measures were being implemented: massive and generalized testing, placement in immediate treatment of cases, active surveillance of suspected cases, hygiene, distancing, and so on. The semi-lockdown in place in Cameroon is not helping, as most of its citizens are still moving around.
Despite preventative measures and recommendations announced by the Cameroonian government in dealing with the rising cases of the new coronavirus, many are not adhering to these measures. Notwithstanding the ban of more than 50 people at public places, this is not the case in Cameroon's economic capital, Douala. The government must take tough action against stubborn people. I, on the other hand, am a shopkeeper.
Hopefully, Cameroon will take this lockdown more seriously and impose the complete lockdown on its citizens to ensure that the global pandemic does not spread across the country and it is curtailed. Next on our list is Ghana. Ghana, as we know, has 1,279 cases, about 10 deaths, and 134 people are now recovered. There is a lockdown in place as many other African countries. On 28th of April, the government of China lifted the movement restrictions in Greater Accra and Greater Kumasi. Mask has been mandated in these areas. More testing clinics has been created, including converting a number of veterinary clinics to test center. Contact tracing has been in place as well, and the general hygiene and social distancing has also been in place in Ghana. Hopefully, the Ghanaian authority will see the importance of this lockdown and make sure that it is enforced again across the entire country to reduce the spread of this global pandemic. Next on our list is Nigeria. Nigeria has confirmed cases of 1,095 and the deaths is currently at 32, and we have recovered cases of 208. In 2014, Nigeria successfully contained the deadly Ebola virus. In fact, according to the World Bank Group, Nigeria is ranked 38.9% on Epidemic Preparedness Index. This is above average in Africa and the world. Also, as we know, Nigeria has the richest man in Africa in Aliko Dangote. Aliko Dangote and all other billionaires in Nigeria, including companies like UBA, have jointly donated about $30.7 million to fight the global pandemic in Nigeria. The President Buhari has made few appearances. In fact, his first speech came over a month after the first case of COVID-19 was recorded. The Chief of Staff of the President, Abba Kyari, has recently been lost as a result of COVID-19. This is a setback to the government in its own, and coupled with the Federal Executive Council suspended indefinitely, this has raised concern on efficiency of the response to deal with COVID-19 in Nigeria. About $2.7 million has been released to the Nigeria Center for Disease Control to fight COVID-19. This is way below the $330 million that was estimated to have been required to fight this pandemic. The federal government has provided its citizens with cash and food, but this has been hampered by poor communications, lack of transparencies, and inefficiencies. And Nigerian citizens protest on the street. They burn down police stations and they cry out that the food that is being distributed is not sufficient enough to help them or to sustain them and their households. And in another dimension, Nigeria has requested to borrow about $6.9 billion to counter coronavirus spread. In terms of the breakdown of this $6.9 billion, the IMF will be borrowing Nigeria $3.4 billion, the World Bank $2.5 billion, Africa Development Bank $1 billion. Nigeria's total debt has now currently skyrocketed to $68.5 billion as of September 2019. Hopefully, Nigeria, being the giant of Africa, will be able to put in place the robust infrastructure and ensure that the COVID-19 pandemic is dealt with, to ensure that it does not spread across all other parts of the country. Lastly on our list is Ivory Coast. Côte d'Ivoire, they currently have the confirmed cases of 1,077 and death is currently at 14 and recovery is around 419. Ivory Coast, like many other African countries, has had few confirmed cases of the virus. The lockdown in Abidjan and nationwide curfew has really helped to keep this to the minimum. There has been compulsory wearing of masks. Ivory Coast has put in place a number of test centers to fight this COVID-19. But also, we need to bear in mind that the aggressive infrastructure that was previously in place to fight Ebola virus in 2014 is still currently being used and now diverted completely to fight COVID-19. There has been complaint from its citizens across various states that there is no enough test centers in place and the citizens are not sure if they actually contract COVID-19 or not due to lack of tests. Hopefully, the Ivorian government will look into this and make sure that there is enough test centers in place for its citizens so that all of these citizens can be tested and they can ensure that, especially those that are feeling the symptoms of COVID-19, and that they can ensure that there is no COVID-19 spreading across the country and they can be curtailed. Moving on to other stories. Have you guys heard of Jean-Paul Mira, a French doctor who said when the COVID-19 vaccine is finally in place, it should be tested first in Africa?
Faire cette étude en Afrique où il n'y a pas de masque, pas de traitement, pas de réanimation, un peu comme c'est fait d'ailleurs pour certaines études dans le sida, où chez les prostituées, on essaye des choses parce qu'on sait qu'elles sont hautement exposées et elles ne se protègent pas. Qu'est-ce que vous en pensez?
This has sparked global outrage. There's been so many commentaries, so many responses from people across the globe on social media. We also have a number of sport personalities that has responded to this, like the Didier Drogba, the former Chelsea and Ivory Coast international football player. He said, "Africa isn't a testing lab. I would like to vividly denounce those demeaning, false, and most of all, deeply racist words." Also, Den Baba, the former Chelsea striker and Senegalese international, has also responded to this as well by saying, "Welcome to the West, where white people believe themselves to be so superior that racism and disability become commonplace." The World Health Organization has responded to this.
When I said when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. And it was a disgrace, actually, and appalling to hear during the 21st century from scientists that kind of remark. And we condemn this with the strongest terms possible.
Moving on to another news. What is happening in China? The way China has responded to COVID-19 on African migrants has been so appalling. There has been so many racial discrimination across China, with African migrants being left to sleep on the street. Even when they have paid their rent to their landlords, they are still being evicted. But to start with, advert like this.
The ad opens with this black painter with his face and shirt smeared with paint, flirting with a Chinese woman as she does her laundry. She beckons him over, acts like she's going to kiss him, and then pops a detergent gel ball into his mouth, shoves him into the washing machine, and sits on the cover. He then emerges as the classical prototype of a Chinese man. Reached by the Wall Street Journal Friday, Zhao Qinbin, a representative of the Shanghai company that makes the detergent, said he wasn't familiar.
Has sparked a global outrage, and this is unacceptable for this kind of advert to be put on public news or public TV in China, and the government has not commented on this. And another way the Chinese government are dealing with it on African migrants is they've been molesting them on the street, attacking them, asking them to leave the country. They should get tested, even if they've been tested previously, and that they should get tested again, and that all of the African migrants are the ones that are bringing COVID-19 to China. This is unacceptable. And that takes me back to my initial question. Why has the world not asked China to provide the source of this global pandemic? If China can come up with the source of it, maybe a solution can be found. It is when you can trace a problem that you can find a solution to it. If you don't identify a problem, there cannot be a solution. I'm not sure what the world leaders are looking at and why they've not asked China to come up with how and where this global pandemic emanated from. I'll leave you guys to comment on the way China has been dealing with African migrants in the country. If you are yet to subscribe to my channel on YouTube, please kindly do so, as there are so many more episodes that are coming your way. We will be looking at all other continents that are mostly hit by COVID-19 and picking the top countries in those continents. I hope you have enjoyed this video today. Thank you so much for watching.